All right. Hello, everyone. My name is Miranda Fernandez. I am a student at San Jose State University, and my presentation is going to be on ovarian cancer. Okay, so what is ovarian cancer? Well, it's when an abnormal growth of cells form on the ovaries. The growth on these cells on the ovaries are out of control and they form a tumor. If you refer to the diagram on the top, you can see what that tumor would look like on the ovaries. Okay, and then what are ovaries? Where are they? If you refer to the diagram on the bottom in the right side, you'll see that the ovaries are a small gland found in the female reproductive system, and they are on either side of the uterus. The ovaries are responsible for forming eggs and making female hormones such as estrogen and progesterone. Okay. Ovarian cancer types. So, well, as you can see from this slide, that there are three types of ovarian cancer. The first type being the most common type of ovarian cancer, which is called epithelial ovarian cancer. Now, this cancer is a tumor that starts on the outside of the ovary, which again is very common. The second type of ovarian cancer is called stromal cancer. Now, this cancer starts from the ovarian cancer cells that make the female hormones. This is rare to happen, but then again, can happen. The third type of ovarian cancer is called germ cell cancer. Now, this cancer starts in the egg cells, which is a very rare form of ovarian cancer. And as you can see from the diagram, you can see where those cancers would be located, each one of them. Ovarian cancer subtypes. So great. So now that we are familiar with the ovarian cancer types, let's talk about the subtypes of ovarian cancer. However, before we get to the names of the ovarian cancer subtypes, I just want to give a little bit of background information first. So ovarian cancer can be divided into 5 different subtypes. Now, these subtypes are very dependent on the patient's age, histology, and the tumor size. So depending on those 3 factors, treatment will vary from case to case. But overall, it is very important information to know so that way the gynecologist, oncologist can make the best possible diagnosis for women for a woman's specific ovarian cancer case. Okay. All right. So what are the subtype names? So the first subtype name is called high-grade serous carcinoma. So this subtype is found when a tumor starts in the epithelial layer. So that means that this is a form of epithelial ovarian cancer. The second subtype is called low-grade serous carcinoma. And this is a subtype that is found also in the epithelial layer. It is a very common type of ovarian cancer. Mucinous carcinoma is a subtype which has an abnormal amount of extracellular pools in the stromal mucin is produced. So that means that it's a form of stromal ovarian cancer, which is a very rare type of ovarian cancer. Endometrioid carcinoma is a subtype, and it's a form of stromal ovarian cancer, also very rare. Clear cell carcinoma is a subtype, and it's a form of the germ cell ovarian cancer type, which is that is the super rare type of cancer to have. Okay, so those are the subtypes. As you can see on the right-hand side, there are some pictures of what those subtypes would look like. All right, so now ovarian cancer stages. So first we're going to start off with the early stages of ovarian cancer. So starting with the first stage, so in the first stage of ovarian cancer, this is when the cancer is found on one or both ovaries. Okay. Stage 2 is when the cancer cells have spread from the ovaries to other parts of the pelvis, such as the fallopian tubes or even the uterus. Okay, so these are the first 2 stages that are considered the early stages of ovarian cancer in this picture on the right side. You can take a look at. Okay. Ovarian cancer stages, so these are considered the late stages. Now we're going to be looking at the late stages. So starting with stage 3. So in stage 3 of ovarian cancer, this is when the cancer cells have spread to outside the pelvis. So to nearby lymph nodes or diaphragm, intestines, and liver outside the pelvis. Stage 4 is when the cancer has spread beyond the abdomen portion of the body. So now the cancer is spreading to organs such as like the lungs or the spleen, etc. So at this point, cancer has spread almost all throughout the body. Okay. Is there a cure? So unfortunately, the answer is no. There is no cure for ovarian cancer, although there are various treatment options to treat it. The most common treatment for ovarian cancer would be chemotherapy and surgery to have the ovaries removed. However, there is a new treatment in the form of medication called Olorib. And current studies are showing data that Olorib is proving to be more effective than chemotherapy. So what is Olorib? Well, it's a medication that is taken orally in tablet form. Olorib is a polypolymerase inhibitor. This form of treatment is used for patients with advanced epithelial ovarian cancer. Therefore, it is a treatment to help patients with the most common type of cancer, which is epithelial ovarian cancer. There is no new information about Olorib helping stromal or germ cell ovarian cancer yet. As of today, Olorib has been FDA approved in Europe and the United States as a beneficial treatment option for patients with epithelial ovarian cancer. Okay, and as you can see on the right-hand side, you can see what the pill looks like and the medication bottle. So why is this form of treatment a great option? Well, Olorib is a drug type called targeted therapy. Okay, so what is targeted therapy? It's cancer treatment that uses drugs to target specific cancer cells, and the drug doesn't affect your normal healthy cells, which is awesome. And you can see here on the right-hand side, kind of show you how Olorib works. And now we're going to talk about how it works. So how does Olorib work? Olorib is, again, a polypolymerase inhibitor, which means that it's a drug that blocks BRCA, which is a mutated gene, and it helps repair DNA. So BRCA mutations also hinder DNA repair. So Olorib can fix that. It causes those cancer cells to carry out a BRCA mutation to make it die, therefore proving that Olorib can also be a great maintenance therapy treatment for patients with the BRCA1 or BRCA2 mutations, those mutated genes. Okay, so tell me more. So, if you're still not convinced that Olorib is a great option for patients with ovarian cancer, there was a study that was called the SOLO-1 study. So this study tested patients with ovarian cancer after they had platinum-based chemotherapy. So now this data shows that patients who received Olorib lived a 3-year progression-free life from their ovarian cancer compared to the patients that received the placebo. And on the right-hand side, you can see that there is the data. That's the chart that the SOLO-1 trial conducted. Okay. Now to recap. So overall, Olorib is a great form of treatment for patients with epithelial ovarian cancer. Olorib can be used before or after chemotherapy, depending on the patient's case in their ovarian cancer journey. Let's see. And that is all I have for you guys today. And if you're curious, these are my sources with all the information I obtained. Okay. Other than that, thank you all so much for watching, and I will talk to you all later.